looking ahead, what sort of advances in drug development, trial methodology, or even neuroimaging do you believe are needed to accelerate the progress in the remyelination space? What is we as a clinical community, what do we need to be continuing to do?
I think the first part, in terms of advances, in terms of understanding the biology of myelin, that's critical, and understanding how much each part of myelination is tied to the other. So how much is, let's say, the length of the myelin internodes, how much are those related to, you know, to how thick the myelin is, or how effectively it conducts signals. Those things need to be better understood, and those are critical for us in developing clinical programs or enhanced clinical programs for remyelination. But most importantly for us in making remyelinating therapies is kind of touching on what you said about neuroimaging, which is not so much development of new techniques, which may be important, but it's also cautious interpretation of what people observe and see. I mean, a lot of people make a lot of assertions about what records myelin. And again, the level of evidence that it truly reflects myelin is only modest for some of these. And I think we've got to be cautious and careful and be wise as a community about that employment. We are at the cusp of really promising developments in terms of remyelinating therapies. We just need the scientific approach to understanding what's going on at a biological level to continue to advance, and the development of those biomarkers to be advanced alongside it. And I do think, we if we do that right, we will get therapies that are going to make a big difference.
I think on the drug discovery and development side, we need to continue to advance and improve some of the human preclinical models. I think that'd be very useful. This includes things like advanced human organoid systems that can both replicate the timing and multicellular aspect of the human disease, including the inflammatory component. On the trial side, I think continued development and validation of biomarkers and imaging measures, as Ari pointed out, that more directly reflect remyelination, and that we can actually link to meaningful clinical outcomes are what will going to ultimately enhance the success of clinical trials in this space. And something that was alluded to in an earlier question is I think it's going to be important that we define the optimal treatment regimens for remyelination in human patients. We certainly need to explore if this kind of base case chronic continuous dosing or daily dosing is equivalent or better than what might be episodic dosing, weekly, monthly, or biomarker driven regimens that are stimulating regenerative processes and then allowing them to go forward to fruition. But I think even with these things aside, there's always room for improvement and opportunities to build these pipelines better. But I really do feel we're at a transformative moment for multiple sclerosis. I think we've really spent decades controlling inflammation, and now we're at the threshold of therapies that can actively rebuild myelin and restore neurological function.
Yeah. And one thing I wanted to add there is, I think, touching on something Paul said earlier about model development. I mean, and his points about rodent oligodendrocytes and whether or not we can extrapolate from what we understand and know about rodent oligodendrocytes over to humans, is the need to develop models that are outside of rodents. So including, primate models and other approaches that may be critical, especially for development of therapeutics that help restore brain function. So for organisms that have a brain system that's closer to the human nervous system may be critically important. We have to obviously do that guided by significant ethical constraints. There's a lot of considerations surrounding that. We have to do it carefully and cautiously, but it's probably critically necessary for the development of therapies that are maximally successful for restoring function for patients.